Hello and welcome to Pune Times Mirror. Today, we are going to have a conversation with the celebrity psychiatrist and sexpert, Dr. Rohan Jahagirdar. Hello, sir. How are you doing today?
Hello, I'm doing well. Thank you for having me. Namaskar.
Usually, you know what, according to you, is stress and what are the causes or signs of stress which can be seen commonly?
Okay. So, stress by definition is anything out of your capacity. Okay. It could be physical, mental, emotional, psychological. Anything beyond your capacity will be considered or called as stress. Stress is not always bad. There is something called as EU stress, which means that helps you perform better. It's a stress which enhances your ability to achieve something by practice, by exposure. Let's say that's how you train athletes. That's how we train exam. That's why we get better at things, because we start learning things under the influence of that stress. The distress, which means when the stress is beyond my ability to handle things, is where it starts affecting you. Okay. There are various symptoms of stress, like cognition, which means the way you think. It affects your thinking. So if I'm right now very, very stressed, I'll start only worried about whether I'm wearing the coat right, whether I'm doing that. It's affecting my thinking. It's all or none. So it affects your thinking, and then you take decision in hassle, you make mistakes, you are saying wrong things. All of that happens because it's affecting your thinking. Right. It affects your emotion. One tends to become more irritable, moody, tearful, again because they are under stress. It can, over a period of time, affect your physical conditions like sleep. A lot of people develop medical conditions also. They may not directly develop because of stress, but stress certainly contributes, like blood pressure, like your diabetes. All of that can change because you are under stress, and that can contribute, the stress can contribute towards the whole situation. So stress affects most of the areas. Stress can present in multiple ways, through directly signs and symptoms or through disorders.
Right. So next I would like to ask, what role do surrounding factors or our surrounding environment play in terms of thinking that I'm developing stress?
See, surrounding environment will certainly contribute a lot, but it's an interaction between you and the environment. So if you are already anxious or you are already worried, a small change in the environment might result in a big change inside you. Okay. Whereas if you are already very confident, even overconfident, even if there is a real situation, you will react poorly to the environment. But typically, the word I would use is reinforcement. Okay. How you are growing with the nature and the surrounding is very important. So, for example, a typical problem, how do you handle it is defined by many things. Your ability to handle the problem, your knowledge of the problem, your experience of the problem, and your way of getting the result. So, environment plays a massive role. Positive reinforcement plays a massive role. Exposure and right training plays a massive role.
Okay. So, are there situations where even if a person is really not stressed, so they can feel that they are under stress? Okay,
a situation where which is not really stressful.
Yeah, but still they feel that they are under stress or some kind of a mental health problem.
Sure. See, somebody who is anxious, for example, or somebody who is having a panic attack, especially let's say somebody who is anxious, might feel stressed with a very small thing. So something that might be very, very simple for you and me might be a very difficult thing for that person. He may not be able to say it, but he will see the signs for it, like palpitations, like sweating, like tremors. A lot of other things might happen to them only because they are under stress. Again, this is something they have to be aware of.
What are the common misconceptions between anxiety, depression and stress, and how do people tend to mix all of the disorders?
Actually, it's a very good question. Stress can be seen as a form of something of both anxiety and depression. So you need to understand that stress itself can affect your emotions. Okay. And a person can become very anxious because of stress, and out of stress, let's say somebody wants to go out, but because they are stressed out too much and did not attend an event or a meeting, they can certainly feel very low about it. So it can mimic that symptoms of feeling low. Okay. So stress can be a direct cause of feeling anxious or feeling low. Okay. When you say anxiety and depression, they are qualified as absolute illnesses. Okay. So if I have anxiety, for example, that may or may not happen with stress. Stress can only increase my anxiety. Stress cannot directly become a cause of my anxiety disorder. It can make me anxious,
Okay.
but it can directly not cause me an anxiety disorder. It's like saying, for example, I have diabetes, already have diabetes. Then if I eat sweets, the sugar might go up. But eating sweets has not caused me diabetes. Okay. Same way, depression. Depression, like I explained, that it is a condition which has to be there, at the mood has to be low for at least a period of 2 weeks. Stress can give me low mood or feeling low for a little while. We all feel low sometimes, but that is not depression. But a person who is depressed, again, might get stressed out very easily with many things. So it works in that proportion.